Good afternoon, everyone. My name is Sean Egan, the Deputy Director for Labor here in Michigan's Department of Labor and Economic Opportunity, and I thank you for joining us today as we talk about what we all know to be just a critically important issue in our society and, of course, in our workplaces. Over the last several weeks, myself and several others have worked through a work group model to identify challenges and opportunities in our workplaces as it relates to workplace mental health, and to identify ways that we can create more resilient workplaces that both recognize the challenges that we all carry with us, as well as opportunities to make our workplaces better, to support people as they continue to work and support their mental health and provide those opportunities for intervention, as well as the opportunity for voice, so that we can have real conversations about how our workplaces work, as well as the things that people need to make themselves and our communities stronger. I'm joined today by my good friend Vickie Choitz from the Corporation for a Skilled Workforce, who's going to kick us off with an introduction to brain science and some of the things that we need to think about in ourselves and our society to make sure that we're building the right pieces to move us forward. Vickie, I'll turn it over to you.
Great, thanks so much, Sean. And I'm going to go ahead and share my screen. We've got a little PowerPoint that we'd like to walk folks through to help understand the brain science of toxic stress, trauma, and resilience. Now, some of you, many of you, have probably experienced some of these symptoms, either through your workforce, maybe your colleagues, your peers, maybe even yourself, particularly over the last 2 years, as we've all been experiencing a lot of toxic stress and trauma due to COVID-19 pandemic, racial reckoning, the financial insecurities, all the anxiety that we're experiencing. So if you've felt or if you've seen anger, anxiety, even body aches or brain fog or confusion or numbness, irritation, just want to let you know that those are actually normal, automatic bodily responses to abnormal experiences. And I listed some of the abnormal experiences, but there's also adverse childhood experiences, which are traumatic experiences that happen to folks before the age of 18. Chronic work stress, which I can guarantee that many of you on this webinar have experienced this. But also we see abnormal experiences that cause these automatic bodily responses from poverty, racial trauma, racial violence and reckoning, war, and secondary trauma for those of us who work in the helping field. The abnormal experiences get processed in our brains as fight, flight, freeze, or submit, or fawn, as Sean has written in the report. So this is just what the brain looks like on toxic stress and trauma. These are normal responses to abnormal experiences. Now, we talked about the adverse childhood experiences. There's actually 3 realms of ACEs, these traumatic experiences that children experience. One realm is in the household with homelessness or divorce or neglect or violence. Another realm is in the community around poverty and violence in our communities that children may experience. And the third area is in the environment. And I'll say that these aren't just adverse experiences that children are affected by, but we're affected by them as adults too. However, adverse childhood experiences have been the most studied among the traumas, along with PTSD. And we actually find that adverse childhood experiences and trauma is pervasive. Around 70% of adults in the city of Philadelphia had experienced one adverse childhood experience, and 40 had experienced 4 or more. So when you think about your workplace and you think about who's in the workplace, keep these statistics in mind, because the adverse childhood experiences and all trauma are very pervasive. Now, we wanted to talk just a minute over the different levels of stress and different types of trauma, because people have been using the word trauma quite a bit to mean a lot of things that really might be more in the toxic stress realm. So we wanted to make sure that folks understood the difference between these two and the similarities. So there's actually different levels of stress, and stress can be positive. Positive stress can be when you have a deadline that you know you need to meet, you're working towards it, and you meet it. It helps you stay alert and awake to get the deadline met. But as stress increases, it increases in severity and it starts to become less positive. So a little bit more stress is tolerable stress. So it's stress that we may be experiencing. Maybe you have somebody on your team, have a vacancy on your team, and so you're filling in and your team members are filling in for other staff members. It's stressful, but it's tolerable. You can manage it. And then when you feel that vacancy, that stress will relieve itself. However, if you start to lose more team members, if the company is starting to become less healthy, you may start to experience toxic stress. And this is actually where when you have too much toxic stress, it'll lead to traumatic stress, which is actually then a type of trauma. So we wanted to stress that the levels of stress can go from decent, good stress to bad stress and actually bridge over to trauma if it gets too severe. I'm not going to go into all the different types of trauma because we only have a few minutes, but I wanted to make you aware that there are different types of trauma that people can experience. And hopefully we'll be able to have a longer conversation about some of these in the future, and we'll be able to go into the definitions of them. So when we experience toxic stress and trauma, it's an automatic bodily function, and our bodies create physical responses. So whether you're being chased by a bear or you're feeling completely overworked and overwhelmed at work, that sets off the body's emergency alarm system. What happens is cortisol and adrenaline, two hormones in our body, start to surge because they're preparing us to be able to survive being chased by the bear. It's the reptilian brain, the oldest part of our brain, just sends this out automatically. And that makes us stronger, it makes us more alert, but it also it's not healthy for our physical bodies. It hurts our heart when too much cortisol and adrenaline are constantly pumping through our system. It weakens our immune system. It leads to anxiety, depression, and headaches because the body is not designed to have all these high levels of cortisol and adrenaline pumping through the body all the time due to toxic stress and trauma and the symptoms that we were just talking about. But I want to let you know, this is all just the normal physical responses that our bodies are designed to engage in to save us from threats like bears and saber-toothed tigers back when we were living in caves. There's also mental effects of toxic stress and trauma, and I know you're going to recognize them when I pull them up. These are the fight, flight, freeze, and submit, or fawn responses that you hear about. But what do they look like at work? So if somebody's engaging in a fight response, if that's just their normal way that they're wired and that's how their body responds to stress, you might see more angry outbursts. You might see them lashing out at people. They might be expressing violence towards themselves or others. Similar with flight. Avoidance of emotion. So it's not just physically trying to flee the situation, but it's also trying to flee engaging with other people, engaging in emotions, going to work if work's a toxic stress place for folks. Freeze is where your mental processing actually diminishes. So this is where the brain fog comes in. This is where if you've had folks who have gotten confused about what their job is, their body may be engaging in a freeze response to toxic stress and trauma. Now, we can't choose those automatic body responses because they just happen before our thinking brain even picks up on them. However, we can choose healthier behaviors and policies to mitigate and respond and address these automatic bodily responses. Understanding the brain science, being able to calm down our brains through breathing exercises and mindfulness. Exercise is a healthy response to help mitigate some of these normal automatic bodily responses. Unfortunately, a lot of people also engage in unhealthy behaviors and policies like drinking and drug use. If there's automatic punitive workplace policies that don't understand the brain science of what's happening in folks' brain when they're experiencing toxic stress and trauma, those can be very unhealthy policies for individuals. So we can choose the behaviors and the policies in our workplace policies to be more toxic stress and trauma informed and resilience building. So now that we're talking about resilience, what is resilience? It's the ability, capacities, and relationships to manage and overcome adversity. Now, the cool thing about resilience is it's not binary. You either don't have it or you have it. but rather it can be built over time, particularly when we're recovering from toxic stress and trauma. The way that I think about it is it's sort of like this cyclical effect. So the more we work on recovering from toxic stress and trauma and avoiding it in the first place, the more we're building resilience to be able to face that toxic stress and trauma. For some reason, I always think about this like an electric car. When you're driving down the road and you see the battery being charged as you're driving, and then when you're sitting at a red light, the battery is draining, but then when you're driving, the battery is charging up again. So it's a similar mechanism to that. There are several families of resilience building that folks should keep in mind and explore on your own when you have a chance. The core, though, is that folks need to feel safe physically, psychologically, and emotionally, and feel valued. So if you're wondering how to address somebody who's experiencing signs of toxic stress or trauma, or if you're wondering how to help somebody build up their resilience in the face of toxic stress and trauma, keep these two things in mind: safety and feeling valued. And here are some of the specific examples of that. So some types of personal resilience building include having a different mindset about the stressful environment. So you can let the stress just weigh you down, or you can think about it as this is a temporary situation. Once we get that new staff person on board, or once that staff person who has COVID comes back from work, then we'll be able to get more on an even keel. Finding meaning in your work is a proven resilience building strategy. As I said, calming your brain with breathing and mindfulness exercises. I call this hacking your brain. So when your brain is off doing its automatic bodily response, you can hack into it with breathing exercises to physically calm it down, and then you can go about whatever you need to go about in your day. It doesn't just fall on the individual, though, and I really want to stress this. Organizations and communities have a responsibility for resilience building and creating a more resilient culture as well. So creating an environment for growth in your company, engaging in collective problem solving, and having employees able to share their voice, share their opinions, being transparent with them about what's coming up and what are some of the things coming up with the company. All of those are resilience building strategies that companies and organizations can engage in. And there's actually a few different organizational self-assessments that you can take to help you understand where you are right now with your organizational toxic stress and trauma levels, and then where you could be improving. And then I also mentioned community. So building resilience building in our communities will help your employees be more resilient at work and in their family lives. So connection and caring environments, being parts of groups, being parts of church congregations, etc. All of that really helps to build our resilience. So what can companies and organizations do in addition to some of the specific strategies that I've just mentioned? Three things. One is train your staff on what is toxic stress and trauma, how they affect us, how they affect our brains, and then what are some of the resilience building strategies we can engage in. You can also assess and address organizational culture. So that's those organizational assessments that I was talking about, and we'd be happy to share those with folks. And then finally, educating your peers at chambers of commerce, at small business association meetings, because we're all facing this across our communities, across companies, up and down in the company. And so the more we understand about toxic stress, trauma, and resilience, the more we understand these automatic bodily responses and what we could be doing to have healthier behaviors, the better off we will all be. So it's just a little quickie on the brain science of toxic stress, trauma, and resilience, and I will turn it back over to Sean. Thank you.
You're muted, Sean.
Sean, you're on mute.
Well, I just made the best point ever, so I appreciate that. And without fail, At the outset, I should have mentioned this is a Q&A. We will try to have 5 to 10 minutes to answer questions that you may have. Might be closer to 5 at this point, but there is a Q&A box that you can type in questions to, and we're going to try to take as many as we can. And this is really heavy information, so we will be sharing a recap as well as the slides that you're seeing today later this week. If you're not signed up on our email list, if you go to our Leo webpage, there's a news sign up at the top and an e-alert sign up at the bottom. So jump on both of those and you'll get all of the material that we're presenting. But I just want to thank Vickie so much. That was sort of a light bulb moment for me and our work group to really recognize that even though we are individuals, we are chemically, genetically are different. When we think about how we're sort of wired, we're going to have the same response. Now, we might have a different response to the same type of event, but we're all going to have a type of stress response that's going to potentially weaken our ability to think logically and enhance our emotional response to events and put us in a situation that can be very challenging for us to get out of. And we really looked at the trauma that Vickie talked about, ACEs, those adverse childhood experiences, poverty, racial discrimination, but also things that we can see from workplaces through different types of research. And we looked at piles and piles of research. And you see these types of symptoms, signs of chronic stress that Vickie was talking about, as well as the bad physical outcomes if we live under conditions of chronic stress. And I have been bold there. Hypertension, depression, addiction, and anxiety disorders are the most common outcome for chronic stress that happen out there. And of course, we know that these lead to severe health issues and otherwise. But what we wanted to do today is just really help everybody identify the vastness of the challenge that we have in front of us to create those resilient workplaces and where people are right now. So from the CEO roundtable with the American Heart Association, they found 76% of employees surveyed agreed that they struggled with at least one mental health issue, but only about 42% of those had been diagnosed, and only a third of those let their employer know. So if you're an employer watching this right now, more than likely you're having a significant impact from mental health in your workplace that you might not be aware of because employees may not be seeking help or they may not tell you that they are. And that puts you in a position to have to respond in ways that you might not be ready for. And in 2020 alone, roughly 48 million people suffered from anxiety disorder and another 21 million had major depressive episodes. And that's important for some of the stats that we're going to look at because anxiety and depression, as Vickie mentioned, are potentially an outcome of chronic stress. And those are widely studied. So we have good cost information on what that's doing to our workplaces. But only about 46%, less than half, actually received treatment for those illnesses in 2020. So while we know we have a challenge with the availability of treatment, we also have a challenge of people wanting to get treatment. And I think we have to think about this in a way that we build organizations and cultures that are supportive, regardless if people are seeking that treatment, but encouraging them to get it. And I say that meaning we can't expect to push that number to 90% in the short run. So we're going to have these things happening and we need to think about that and plan accordingly. And about 1 in 5 people every single year is going to have a mental illness. And when we say mental illness, that doesn't necessarily mean it's permanent, but it does mean that they're going to have one of these experiences that are not going to be very, very good for them. And where people are because of the pandemic is very challenging for all of us. Now we look around in the news and we see a lot of very peculiar things happening. And part of that's because we're all experiencing a collective trauma. This is all back in our workplaces. This is all back in our communities. This is all back wherever we are, where people reporting symptoms of anxiety and depression, just symptoms, to the Kaiser Family Foundation jumped 30% over the course of a year. And the big piece of this is because of the pandemic. Now, when you throw in other things like the war in Ukraine, inflation that we're all dealing with, we can see these continuing to increase. So we're in a very difficult spot for all of us where we need to manage a collective trauma that we're experiencing and recognizing these challenges in ourselves. But workplaces are in here too. So when the Mental Health Association surveyed workers, employees that are actually employed, about 83% said they feel emotionally drained from their work. And emotionally drained is significant because that is the precursor to burnout. Burnout leads to those other conditions we've been talking about, including anxiety and depression, and it's something we need to manage. And in our work group, we kind of looked at, so what types of stress are in the workplace? What are common? Some of the common ones, of course, are overwork, job quality, job insecurity, bullying and harassment, perhaps workplace violence. And these are big challenges. Now, this was just a small sample, but as we all know, there are big challenges for all of us. And what else was found is that this is across all types of work. So what you see there in gray is office and administrative folks, blue or blue collar or physically demanding jobs, and then red are people that interact with customers. So among these groups, over a third in any of these categories pretty much are feeling pretty exhausted in their workplaces right now. And you see this across categories as well. This is management and frontline workers. So we have a big challenge in front of us with people really in a position where we need to engage quickly and rapidly to find ways to make sure that we're supporting mental health in the workplace in a way that can help people sort of get back to what I call neutral, as Vickie was talking about, get us back to using our logic center instead of our emotional response and help us all move forward. But why workplaces? Well, first and foremost, that's where we spend most of our waking hours. In many surveys, 65% of employees identified their job as their number one stress in their lives. Now, we can't draw a line there. When people are stressed, they can't necessarily say it's this or that, but there is a connection, at least in employees' minds, to their workplace that we need to be cognizant of. And workplaces are bearing most of these costs. You're either doing that through medical care or what we call the sort of invisible costs. Now, you'll look around, you'll do some research, and you'll find that over and over again, you'll see this number that there's a $4 return for each dollar invested into mental health. That was started with the WHO, but you'll find it in almost any study that you do, and it kind of varies depending on what issue you're talking about, but it is multiples of that dollar invested, between 2 and 5, depending on what you're trying to tackle. So there's a cost advantage here, but there's a lot of invisible costs. Major depressive disorder alone accounts for 27 or more lost workdays annually per person experiencing those conditions. So that is significant in and of itself. And presenteeism is perhaps even more costly and more difficult to manage. Now, presenteeism occurs when I show up to work, but because I'm in either a depression or anxiety or in that freeze mode that Vickie talked about, I can't move forward. So it's not as though these are bad employees. Their mind is in a position where they just can't move forward. And that's about 37% of all of the top 10 most expensive chronic conditions found by Tufts University, and cost the average employer about $109 per employee, not just those experiencing it, but every employee you have. And when you start adding those kind of thoughts to the bottom line, that's pretty expensive. And just on prevalence data alone, remember what I said, that less than half are actually seeking treatment. So prevalence data on depressive conditions, an employer with 10,000 or more employees probably has 1,000 that are experiencing depression now. And you can find some great calculators for small business, because these multiples apply all the way down the spectrum to figure out how much this might be costing you in those invisible costs. And then chronic stress and job stress accounts for about 40% of all the turnover that we may be seeing. So there's a lot of good business case to be had on why this is a critical investment for employers and making stronger communities. And there is great news about it. So Gallup did a poll of workers and found that of those employees who strongly agree that their employer cares about their overall well-being, 71% are less likely to experience burnout. The good news for employers, 69% less likely to search for a new job. That means they're going to stay put because they're happy with the place that they work. And of course, more likely to advocate for their employer, more likely to be engaged at work because we're not having that presenteeism, and a third more likely to be thriving in their own personal life. So it's just a huge investment, that return on investment that employers can see there. So our work group only met for 5 or 6 weeks. We weren't in a position to solve all these problems, but we did identify sort of starting blocks for employers that they can consider there. Vickie had mentioned assessing your workplace. There's a lot of great tools in our report. You'll find a link to at least one of them. There are other tools you can use to sort of assess your workplace. Our work group did discuss it's important that employers be transparent and honest with what they're doing with the survey to make sure that employees will give honest answers. Definitely look at your workplace policies, practices, and procedures. We have a few examples of that. Recommitting to employee assistance programs. Now, what you'll find on employee assistance programs, which are a great tool available to employees, that only about 5% of employees are using them. So that's a problem we have to solve, is to make that tool more available and more accessible and something that employees will actually engage with. And then, as Vickie mentioned, meaningful work, engaging employees, empowering employees. These can be employee resource groups, other tools, adding mental health to your safety committees if you have those. All of these things can just kind of help get the ball rolling, breaking down that stigma and making sure that we can have the discussions. And just a real quick thank you to all the folks that helped us on the work group. They put in hours and hours to put together the report that's publicly available. Great report on all of this information, a lot of great other information that I'm not talking about today, but just real thank you to all of them for really supporting these efforts and making sure that we could move it forward. And again, that report is publicly available and will be included with the reminder or the recap that we send out later this week for everybody, so that they can read through it more thoroughly than the 30 minutes that we gave it today. So I'll stop there for a minute so we can try to get to any questions that we might have.
All right, thanks for all that information, Sean and Vickie. We do have some questions that have come in, but just a reminder, we'll try to get to as many as we can, so feel free to add yours with the Q&A function. The first question is mindfulness and awareness of your own thoughts? Vickie, do you want to take that one?
Mindfulness is actually an awareness of your physical surrounding. So the way that it works is your brain will start to kind of go crazy like a hamster wheel, thinking about everything you have to do, think about everything you're worrying about. Mindfulness is recognizing that you are in a safe space in the current place that you're in, and it helps to offset your mind kind of running away with those thoughts. It's a real grounding exercise.
And I had to go along with that, I had a great discussion on this topic the other day, and I shared with everybody that even in myself, when we think about mindfulness or resiliency, I can't always identify the source, but I can identify the feeling. So I know that when I'm starting to feel a certain way, I need to really be thinking about how I'm going to respond. So I don't know if that's what the person was getting at, but I did want to share that thought, because I think it's really important for us to think about, like, oh, I'm starting to feel something. And maybe not be able to go like, hey, it's that thing over there, but be able to make sure that I can respond appropriately.
Excellent. The next question we have says, are there any techniques that could help with grief?
I am not an expert on that one, so I think we're going to have to pass.
No problem. All right. Sean, I think this one would be best for you. Are there more in-depth mental health seminars or training opportunities available through the state of Michigan?
So we believe that this work group was a great foundation. We did have recommendations for the state that included developing potentially resource hubs for employers to use, where they could not only share best practices, but find policies to break into industry clusters, so we could identify more specifically what certain industries might be encountering and how we can manage that. Think about healthcare and education. And we certainly are going to continue this discussion and be available for webinars on this topic. And we need to really build. There's no, I'd love to tell you if you do X, Y, and Z, everything will be fine, but it's not quite that simple. So we are going to continue to build out resources and opportunities. So we will circle back, but we are available to continue this discussion as well.
Well, I think that actually answered the next couple of questions I saw come through, Sean. So that's all we have for now. There was one other question in there that asked about a recording of this webinar. We are recording it. We will share it out with our list that we have, and as well as putting it on our social media accounts. So if anyone missed it, you can find it on the Michigan Department of Labor and Economic Opportunities Facebook account. So I'll turn it over to you, Sean, to close us out.
Well, that's a whole lot of information in 30 minutes. And our goal today was to really give you a primer on some of the things that we're talking about, some of the things that we found, and give you access to our report and other information that you could use to help us start to build more resiliency in ourselves and our workplaces. I think we're right at the foundational stage, and this is important, and we need to continue pushing it forward, both in the private sector as well as the public sector. And the state as an entity is committed to making sure we continue to have these discussions to talk about resilient workplaces and build stronger communities. And I think first and foremost, as we move out into the world and help amplify this message, we have to remember that no matter what we are doing, we are all human beings and we're going to have different experiences. And we need to recognize that although I might not understand what's happening with you, something might be happening with you, and I need to be compassionate about that. And we need to recognize that it's okay to not be okay and be in a position to say, I need help, or find ways to be for that mindfulness, or find ways to get yourself back to neutral. But if you need help, get help. And you'll find other statistics in our report about sort of suicides, substance abuse, drug use in different industries as well, which is just one of those many symptoms that come out of some of the challenges that we're facing. So this is a critically important issue. I thank you all for joining. Please help us amplify the message, share this out with whomever you think is appropriate. And I look forward to working with you all to make sure that we are continuing to build a stronger Michigan.